I would like to introduce now Ms. Amy Pisani with Every Child by Two.
Thank you very much for having me here today. Congresswoman Elmers and Congressman Burgess. We come at this at quite a different angle. I'm more of the advocacy side, and so I guess we're sort of the downstream side of the groups that have seen how the sausage is made and how the sausage is kept safe. And I think that when we look at the work that we do with regard to Every Child by Two, we're so grateful that this has become a bipartisan effort. As many of you know, Rosalynn Carter, former First Lady Rosalynn Carter, and Senator's wife, Betty Bumpers, formed Every Child by Two nearly 25 years ago. And although they are two Democratic ladies, they are certainly in the bipartisan realm. And we've seen so many great things happen in the last 25 years on both sides of the aisle. Incredible programs were developed, like the Vaccine Injury Compensation Program, the Vaccines for Children program, which had bipartisan support. And I think that right now, the biggest challenges that we're seeing are really in the public health infrastructure. And so while we are so grateful for all the research that goes on, and we're clamoring for new vaccines to save even more children and adolescents and adults, we really deal with that sort of downstream consumer issue of public confidence in vaccines and really needing to help develop a better understanding of all the safety systems that are in place now. We have a good understanding of them, and we feel safe and secure with our vaccines, but we feel that the public is just simply not aware of what goes into marketing a vaccine, pre-licensure, how long it takes, and then post-licensure, all the great, incredible systems that are keeping an eye on the vaccines that we get every day to make sure that they are safe. And so that is a lot of what we do every day. We deal with the public, we deal with concerns. We work with our partners at every level, at CDC, at HHS. We work with all the nonprofits that support vaccines, Meningitis Angels and Families Fighting Flu. And again, a lot of our time goes into reassuring the public about these incredible life-saving vaccines that most of us believe and get for our children on time, but several, as more and more public confidence is lowering in vaccines, I think that we're just dealing with a greater need to assure them and let them know that not only do we have incredible vaccines now, but vaccines for RSV, Group B strep, they're coming down the pike, and in order for us to get folks to use them, we need to make sure that the confidence is there now. And that includes the new meningococcal vaccine that will come out for teens. People are clamoring for it, but when it comes down to it, will they in fact get it for their children and their adolescents? We don't know. But I think that's really a part of what we can work on here in this room. And just a couple more points. The infrastructure. We do a lot of work with advocacy, dealing with the infrastructure for vaccines. We work with the Association of Immunization Managers. We are a founding member of the 317 Coalition, and as you know, the 317 line item is where the funding goes to CDC that trickles down into the states. It's been incredibly underfunded as far as I can recall. I've been here for 18 years, and I really don't recall when it was appropriately funded. The CDC gives a terrific professional judgment of their budget needs every year, and just in 2014 alone, the CDC estimated a $963 million need, and we were appropriating $612 million. So again, this is that web that everyone depends on. We're clamoring, everyone's talking about Ebola, and there was the anthrax scares, and there's pandemics, and there's H1N1. These are the people at the local level who are just dealing with crisis after crisis, and yet their infrastructure isn't even being funded to develop and create immunization information systems, to implement 2D barcodes, to implement insurance claims so that they can actually be reimbursed for vaccines. They're the folks that are making sure that vaccines are stored correctly, training doctors about how to buy refrigerators and store them, just the little things that really are taken for granted. And so I would just love to have a little bit of conversation about making sure that we're here, we're able to develop new vaccines, but we're also able to support the ones that we already have in place.
Thank you, Ms. Pisani. I'd like to introduce now Ms. Susan Silverman with Pfizer, and thank you for being with us. I had the opportunity of meeting with Ms. Silverman probably a little over a year ago, and thank you for being with us.
Thank you. Thank you, Congresswoman Elmers. Thank you, Congressman Burgess, and I want to thank the committee as a member of my colleagues from the industry to be at the same table with all of our partners in public service and public health and agencies and advocacy groups. It's a great honor to talk about a subject that's extremely important to all of us. 21st Century Cures Initiative talks about aligning three things. I think discovery, development, and delivery of medicines, of vaccines, of healthcare in general. We do that every day with vaccines, and we talk about it in a different way. We probably talk about approval, recommendation, and reimbursement. And for us, those are the same three legs of that stool that allow us to get a vaccine from a lab bench into a patient in the community. It's very interesting also, Congresswoman, that we're here in your home district in North Carolina, which is so hospitable for biotech. I actually spent the last day and a half at our site in Sanford, not too far away, which is one of our core vaccine sites. It's one of our oldest sites. It's right down the road. We've had vaccine research and development and manufacturing there for over 30 years. We have about 500 employees, and the average tenure of those employees is over a decade. So we really have a committed base of strong colleagues with a real strong background in vaccine development and delivery. And it's very important for us to be here today and to be with this great group on this panel. We know vaccines are cost effective. They're the most cost effective, probably one of the most cost effective investments in public health the world has made. I have some statistic too to share today. I think since 1924, over 103 million cases of childhood infection have been prevented by vaccines alone. That's pretty staggering numbers together with the metrics that the Congresswoman shared as well. Our Prevnar 13 has done a lot for children in the United States and around the world. And in fact, what I like to say is it keeps children in school, it keeps adults at work, and now, very importantly, it should keep adults out of the hospital. Because we know that the cost of a hospital, say, for pneumococcal infection, runs anywhere from $5,000 to $9,000, whether you're an adult or a child. So we know it's a cost-effective treatment, and we worked very hard to bring that vaccine to market for infants, and now as well recommended for adults. We know that the industry is going through a tremendous transformation in terms of scientific breakthroughs, the things we know. I think it was said by one of the other panelists that the easy vaccines are done. You can always make them better, but we're really working on the higher hanging fruit, if you will, the vaccines that are harder to discover and develop and deliver. And what we really need is to focus on those areas of highest unmet medical need. We are very privileged to have been working for the past, I'd say, 8 years with the FDA to develop the guidelines for our Meningococcal B Vaccine, which will be introduced to, our PDUFA date is Valentine's Day, and hopefully we'll be working very, very hard. It's a devastating condition. We know there have been outbreaks in the United States in the last 2 years. Recently, a tragic death of a nursing student at Georgetown University. People shouldn't die from vaccine-preventable diseases. And so our goal in being here today is to work together with the members of this committee to work on several important areas of alignment around all the agencies around this table, as well as the reimbursement agencies, whether it's CMS or private payers. We have a number of other exciting vaccines in development for Clostridium difficile, Staphylococcus aureus, 2 important debilitating hospital infections. We also know that in the United States alone, the cost of surgical site infections from Staphylococcus aureus costs close to $15 billion a year to the U.S. healthcare system. And it can add from anywhere from 2 to 4 weeks of additional hospital days after surgery. So we know what's important, and we know we're trying to work to speed these things and to speed them along and to move quickly, but also, as Dr. Midtun said, safely and effectively. We need to really align across the many agencies. So my first point from the industry perspective today would be to talk really clearly about aligning across the approval, the recommendation, and the coverage process, and to make sure that we can get those vaccines from the lab into patients as soon as possible. We're at the last leg of the school for Prevnar 13. We're in the process of working together with CMS to clarify reimbursement for our pneumococcal conjugate vaccine for adults. So we have the approval, we have the recommendation, but we still don't have the third leg of the school completely clarified. I think the second point of working together would also be to work together on another very important issue for vaccines. We know they can do a lot of good, but they have to be used equally among all people in the United States. And we know that there's Healthy People 2020 goals the CDC has put out for many of the vaccines they've recommended, whether it's influenza, meningococcal disease, pneumococcal disease, or others. And we know that we're not achieving those goals at all levels. All Americans are not achieving the same level of coverage and compliance as they should. And we think that's the area of vaccine disparities and equality is another area we'd like to have stronger partnerships across the public and the private sector to make sure that all Americans have access to these life-saving vaccines. I can say I'm very excited. I think you can tell I'm very excited to be here. I'm very invested in this initiative and in our vaccines work together. I think it's a privilege to be a part of such an illustrious panel and such a great discussion today. I do believe that vaccines have done a tremendous amount to change the world, and I think they can do a lot more if we continue to work together. I think we can make the world a healthier place, and it will be one vaccine, one person at a time. Thank you very much.
Thank you, Ms. Silverman. I'd like to introduce now Dr. Clement Lewin with Novartis.
Thank you very much, Representative Elmers and Burgess, for the opportunity to share Novartis' perspective and be part of this distinguished panel. I'm particularly pleased to be in North Carolina, the site of our state-of-the-art cell-based influenza manufacturing facility. I won't go into it because it was mentioned by several people already, which was done in partnership with BARDA. One of the reasons we are cited here is the availability of the skilled workforce, the high quality of the local education institutions which were mentioned, and the willingness of state and local authorities to partner with Novartis. I'd like to focus on two areas. One, the ability to develop and manufacture vaccines routinely administered in the United States. And two, the capabilities to ensure our nation is prepared to rapidly respond to an emerging threat through vaccine production. The theme spanning both areas is something that I think every panelist has touched on, is the importance of strong, sustained public and private partnerships. Novartis and the other vaccine manufacturers possess unique capabilities critical to our national vaccine enterprise. A great example of the public-private partnership, I think, is the recent work between Novartis, CDC, and CBER to make a B vaccine available under expanded use IND to deal with outbreaks of disease at Princeton and UCSB. Over 15,000 people got the vaccine thanks to that partnership. The enterprise is fragile, and there are challenges that need to be addressed, and I think many of them have been touched on already today. And I think that the key things are we need to improve coverage rates in adults, we need to ensure adequate reimbursement for providers, and we need to maintain the attractiveness of the vaccine market for manufacturers to invest. Innovation, as somebody has been mentioned, is a particular concern because I like the idea where the low-hanging fruit is gone, we're at the high-hanging fruit. And I think we can address these challenges by making certain that CBER has adequate resources for the best possible regulatory science, that there's a consistent and transparent process for recommendations, and that we build on the immunization platforms in adults and pregnant women. I like to think of it as the baseball analogy or the movie analogy. If you build it, they will come. If we achieve high coverage rates for adults and pregnant women, more vaccines will be developed. Now, over the last decade, a new term has emerged: global health security. An outbreak anywhere is a threat everywhere. A key component of global health security is a rapid response to an emerging threat. Novartis has been at the forefront of these activities for the last 10 years with a focus on pandemic influenza. And so I think we've been working with Robin for a decade, if not more. Responding to emerging threats depends on the maintenance of manufacturing facilities and core competence in vaccines and vaccine production and development. Now, constant practice is required to improve capabilities. Manufacturing facilities can't be mothballed. Expertise can't be allowed to atrophy, and solutions must be improved. While Novartis is committed to supporting the preparedness efforts, funding is required, and the U.S. government is really our sole customer. Consistent, substantial, and transparent funding by the USG is critical to sustain the public-private partnership that provides an increasingly effective response capability that Robin discussed. So the vaccine industry, the vaccine enterprise in which industry plays a crucial role, has been successful in both reducing the burden of disease and improving rapid response capabilities. We should not rest on our laurels, but ensure that an environment is in place to nurture the public-private partnership that's critical for continued success. And I think this panel is a great example of all of us sitting at the table and sharing ideas, and there's many common themes that are emerging. So thank you very much for that opportunity.
Thank you, Dr. Lewin. I'd like to